Well, potentially, a foot ulcer that ultimately blossoms into a huge ulcer and then compromises even the bones of the feet will turn into a downward sort of spiraling cascade of events. I mean, a wound can turn into a bone infection, which can in turn lead to amputation of digits. And then, from there, it's just a very difficult thing for a diabetic to deal with, losing toes, losing a foot, losing a limb. So a lot of that can all be prevented just from being aggressive with wound care, being aggressive with controlling blood sugar and things like that to prevent. It's all about prevention. So if we can kind of stay on top of what the arteries look like, what the skin looks like, and just be proactive instead of reactive, I think that's the most important.